My name is Banim Patnagar. Thank you for joining, as I just said. Today is World Mental Health Day, and we are pleased to release the results of a landmark survey of the mental health of doctors and nurses in Europe. The findings are sobering, and we will go through them in a minute. And as the first of its kind, it really sets an important benchmark for us to measure progress in the years ahead. We hope journalists will use this report as a vital source of information in the months and years ahead. Before handing over to the Regional Director, Dr. Hans Kluge, who will walk you through the findings of the report, let me introduce also Dr. Natasha Azzopardi Muscat, sitting to his left, our Director of Health Systems, who is also on hand to take your questions. And online, we also have Dr. Ledia Lazeri, our Regional Advisor on Mental Health, as well as Dr. Tomas Zapata, our Unit Head on Health Workforce and Service Delivery. We also have an EU representative joining us today. They funded this report, and of course the countries covered in the report are the EU 27 plus 2. Ms. Mathews is the Deputy Director for Digital, EU for Health and Health Systems Modernization at DG SANTE, European Commission. So, without further ado, Regional Director Dr. Kluge, you have the floor.
Good morning, everyone. Europe's health systems are under threat, and mental health is at the heart of the crisis. The largest mental health survey of its kind shows the people who care for us, our doctors and nurses, are working in conditions that are actively harming their mental health. The landmark survey of the mental health of nurses and doctors, or MENT for short, was conducted by the WHO Regional Office for Europe with support from the European Commission. We gathered and analyzed over 90,000 responses from 29 countries, including all 27 European Union members, plus Iceland and Norway. The message from the front lines of healthcare is clear. Europe faces a mounting health workforce emergency, which can no longer be ignored. Let's take a closer look. The findings are stark and frankly unacceptable. A staggering 1 in 3 doctors and 1 in 4 nurses are grappling with symptoms of depression or anxiety. Doctors and nurses are 5 times as likely as the general population to experience symptoms of depression, 32% versus 6%. Beyond the daily struggle, there is a much darker reality. 1 in 10 doctors and nurses report thoughts of being better off dead or harming themselves. Let that sink in. We know these types of passive suicidal thoughts can predict future suicidal behavior. The prevalence of suicidal thoughts among doctors and nurses is double that of the general population. In the past year, 10% report exposure to physical violence and sexual harassment, while 1 in 3 doctors and nurses were exposed to bullying or violent threats at work. Critically, workers exposed to violence, harassment, and bullying report up to double the prevalence of mental health difficulties compared to the general population. Meanwhile, nearly a third of doctors and a quarter of nurses are on temporary employment contracts, a factor strongly linked to increased anxiety about job security. Excessive workloads and harmful conditions are not helping. 1 in 4 doctors works over 50 hours per week. Longer hours and more frequent night shifts increase the risk of mental health difficulties. Between 11 and 34% of health workers said they were thinking about leaving their jobs. And this comes as Europe already faces a projected shortage of 940,000 health workers by 2030. We simply cannot afford to lose them to burnout, despair, or violence. The consequences of this crisis extend far beyond the individual. This is a health security crisis, jeopardizing the functioning of our health systems. Supporting the mental health of our health workers is not just the right thing to do. It is essential for the future of healthcare in Europe. WHO Europe is outlining urgent policy actions that can be implemented right now to change organization cultures and improve working conditions, even without additional resources. And these actions include, number one, enforcing a zero-tolerance approach to violence of any kind, including bullying and harassment in healthcare workplaces. Number two, making sure shifts are flexible and predictable so that doctors and nurses can have a healthy work-life balance. Number three, end the culture of work till exhaustion. Number four, managing heavy workloads with smart recruitments, long-term workforce planning, and better use of digital tools and AI. Number five, training and holding health leaders accountable for their workplace culture and employee well-being. Expanding access to confidential, stigma-free mental health support available and accessible to all workers. And seven, conducting regular monitoring and reporting of health worker well-being, just like we already do for hospital capacity or surgical outcomes. Now I'd like to end on a positive note. Our survey also showed that despite the many difficulties they face, our health workers are driven by a profound sense of duty, showing up for their patients every single day. 3 out of 4 doctors and 2 out of 3 nurses expressed a strong sense of purpose in their work. They are passionate and motivated, but they need tailored support to do their jobs effectively and with compassion. The resilience of our health systems is only as good as the resilience of the women and men who dedicate their lives to caring for all of us. Let this survey be the alarm we can no longer ignore. A profession chosen with humanity and purpose should never demand the sacrifice of health and dignity. The future of care in the European region depends on the well-being of its workforce. Protecting them is protecting every patient, every family, every community. Thank you.
Thank you so much, Regional Director. I'd now like to give the floor to Ms. Maya Mathews from DG SANTE, European Commission. Maya, good morning, welcome. You have the floor.
Good morning, and I would like to start by thanking you for inviting me to the launch of this very important report. I think it's very fitting today on World Mental Health Day that we shine a light on the mental health of the thousands of women and men who dedicate their lives to helping and healing us. This report also serves as a good reminder to ask questions about mental health and above all listen, because people's struggles with mental health are often invisible, so we need to ask questions. This is why 2 years ago, the European Commission took the significant step to ask WHO to carry out this important report. And I think the sobering results that we see today show that it was right to focus on this area. As the survey confirms, the state of mental health in the healthcare sector is truly concerning. Mental health is a high priority for the European Commission. This is reflected in the political guidelines presented by President von der Leyen, as well as the mission letter of Health Commissioner Vaheli. The Commission continues to support member states and stakeholders in improving mental health through the communication on a comprehensive approach to mental health. This ambitious effort was funded by almost 1.3 billion euros and is made up of 20 flagship initiatives. And I'm pleased to say that this report today is an important contribution to this communication, as is the excellent collaboration with WHO. And our collaboration with WHO does not stop at this report. We are working very closely with WHO Europe Office on many aspects related to mental health. One of them is further providing support to member states via policy dialogues and capacity building for mental health reforms. This collaboration with WHO is supported by 11 million euros under the EU for Health programme. Another flagship is the Promens project, which provides multidisciplinary training and exchange on comprehensive approaches to mental health for health professionals and social workers. Coming back to today's report, I think it's also important to see where we are addressing some of the key issues that have come up. And I think that one of the big issues we saw was the pressure on working time, on excessive working hours, as we said, this culture to work until exhaustion. And for that, there needs to be very good health workforce planning. So we are working with WHO and other partners in the member states to really try to find ways to plan the workforce, not only in times of continual times, but also in times of crisis. And this is what we're doing through the Joint Action Heroes, where WHO is also a part of it. The other work we're doing with WHO is a dedicated action on addressing the shortages of nurses. And this action is providing mentoring programs, workforce impact assessments, strategies for health and well-being, and more. So I take this opportunity today to thank all the colleagues at WHO Europe Office for all of their work. I would like to thank my colleagues in the European Commission, and above all, the 90,000 participants who gave us their time. And we all know that nurses and doctors do not have much time, to filling in the questionnaires and providing us with this very rich and illuminating report. Supporting the mental health of the health workforce is an integral part to maintaining a resilient, effective, and compassionate healthcare system for the benefit of us all. Thank you very much.
Thank you so much, Ms. Mathews, for those remarks. So that concludes the remarks, and we're now going to open the floor for questions. As I mentioned in the chat, the EU won't be taking questions today, but if you do have any questions for DG SANTE, please do send them our way and we'll redirect them. But I see we have a hand up in the call, Jeremy from RFI. Jeremy, please unmute yourself and ask your question.
Thank you for the opportunity. I'd like to ask a question about the alcohol consumption among health workers. It seems really high among certain categories, certain countries. France, for instance, I think is #1 in terms of consumption of alcohol among health workers. I'd like to understand the particular reason for that. Why certain countries are ranking high in that particular aspect, and why is France so high?
Thank you for that question. I think we'll go to Natasha, and then if you'd like, maybe bring in one of our other speakers.
Thank you very much for that question. And of course, the findings of the survey need to be evaluated in the broader context of the country concerned. So one would also need to look at the general levels also of alcohol consumption. But I would like to bring in my colleague from mental health, Dr. Ledia Lazeri, to perhaps say a few words about what we have seen from the survey more deeply on reported alcohol consumption.
Thank you, dear Natasha, and good morning to everybody. Thank you for the question to Radio France International. The alcohol consumption in those cases can be seen as an indicator of a maladjusted effort to counter-effect the anxiety. I think we need to read the alcohol dependence figures in connection to the anxiety, because if you see, while we have strict figures about the use of alcohol among doctors and nurses, and mind you, male doctors seem to have the highest alcohol use, we also see at the same time the levels of anxiety among doctors and nurses. And the report, if you go to the report, you will see the respective figures, not only in France, but also the aggregation for the region. So we cannot read the alcohol figures separated from the other figures that we see in the report. This can be, as I said, a symptom or an indication of the maladaptive efforts to counter-effect the anxiety and probably feelings of depression that have clearly been shown through the survey. Thank you.
Much, Dr. Lazeri, for that. Media colleagues, please do raise your hands or write your questions in the chat. In the meantime, I'm going to go to a couple of questions that we received in advance. And Natasha, I'm going to come back to you if that's all right, because we do get asked a lot about digital tools, including AI, and what their role is or may not be in trying to alleviate some of these problems in mental health that we're seeing in the workforce.
Thank you, Banu. This is a very important question because in view of the health workforce shortages that many countries are facing, there are those who really are hoping that digital technologies and AI will, let's say, plug the gap and address this issue. And as WHO, from work that we are doing also with our unit focusing on data, digital and AI, and we will have a report issued in November surveying the state of readiness for AI, what we can see already is that clearly, if implemented well, AI and digital technologies can help to reduce administrative burden, can support the quality of care, and can also in some way complement the work and care of health professionals. But there are limits to what digital technologies and AI can do. And I think it's very important that we recognize that these professions provide care, and the humanity associated with care cannot be replaced by machines. And there is a clear need to ensure that all developments take into account the needs of the health professionals and give time to health professionals to care. Having said that, what we are seeing also is that greater efforts need to be made to train our health professionals, to provide them with the competence and the confidence to use these technologies. And in the midst of what we are seeing today, which is an exhausted health workforce, it sometimes is also difficult then to introduce the time and the space for the workforce to positively embrace and adapt to a fast-changing environment, which in itself can also be a cause of anxiety. So it's complex, and we are looking into this, researching and working closely with professional associations, who I would like to thank, if you would allow me, Banu, I would really like to thank the European Federation of Nurses Associations, the European Forum of National Nursing and Midwifery Associations, the European Junior Doctors Association, the European Union of General Practitioners and Family Physicians, the European Union of Medical Specialists, and the Standing Committee of European Doctors, because without their support, this survey would not have happened.
Great. Thank you so much, dear Natasha, for that. We have some more hands up on the Zoom. Ashwin, if you could unmute yourself and please also introduce your outlet.
Thank you. Thank you for considering my question. My question is, in addition to the intrinsic pressures of the medical practice and commercial medicine practice from the hospital authorities have overburdened their physicians and nurses. Due to this, physicians often experience interpersonal stresses in the workplace. Can panelists elaborate on this? Thank you.
Sorry, you're asking to elaborate on what exactly?
How the pressurization of the hospitals authorities has disturbing the mental and physical health of the physician and nurses.
Okay, I think we might bring Tomas in on this because If I've understood your question correctly, we'll bring in Dr. Tomas Zapata. The question is around how the pressures faced by health systems, in particular hospital administrations and management, etc., are filtering down into sort of poor mental health among health workers. Tomas, over to you.
Thank you so much, Manu, and thank you for the question, which I think is really relevant, because what we see in hospitals, but also in health centers in the survey, is that there is a direct correlation, for example, with some risk factors that are contributing to poor mental health. One of them is the increased working hours, and we see that on average, 1 in 4 doctors work more than 50 hours, as Dr. Hans Kluge was mentioning before. And there is a direct correlation between the number of working hours and the increased mental health problems. So definitely the increased workload in hospitals in the European Union is contributing to these increased mental health problems. At the same time, night shifts is another component risk factor that is contributing to the poor mental health. So it has something in terms of how we organize health services, or how hospitals can organize health services. Because what we see in the survey as well is that 1 in 3 doctors is doing more than 1 night shift per week or more. And then we also have some protective factors which relate to the management and leadership in the health institutions. So what we see is that those institutions that have a good leadership, that the health worker, the doctor, the nurse feel supported by the supervisor or by the management, they report much lower anxiety and depression rates, 17% of depression, for example, according to the survey. Whereas when they feel kind of abandoned, not having support for the management and the leadership, then the depression rates go as high as 45%. So there is a huge impact in terms of how good the leadership and management in the health institution is in terms of improving or having worse mental health problems. Thank you.
Thank you so much, Dr. Zapata, for that answer. We have a question in the chat received from Bulgarian National Radio, Maria. She asks, Natasha, I'm going to come to you and perhaps others on this. How do you plan to change the culture which leads to exhaustion and overworking? Over to you.
Thank you, Manu. And I think this goes back to our original report in 2022, Time to Act, and the strategy and resolution that was adopted by our member states in 2023, where we are saying there needs to be a very comprehensive approach. One, which is what we are focusing on today, which is to retain our health workforce and to retain them feeling well, healthy, and productive. Secondly, we need to look at the pipeline and to find ways to make these professions more attractive and to ensure that there is the training. The third area is what I alluded to earlier, which is really about trying to ensure that technology and people work together. Coming to the earlier question too, as for example, hospitals and healthcare facilities become more capital intensive, what we tend to see is a desire to have a return on investment on the capital and use that capital for longer. This, of course, however, means that we are stretching our health workers further and making them work longer. And then finally, the 2 other elements are around the planning and government and the investment. Tackling all these together, we can make a difference. But as Dr. Hans Kluge mentioned, we need to start measuring this. And our call as WHO today is that as part of any routine monitoring, and I know that there are already many healthcare organizations, several healthcare organizations that are finding ways to introduce this, that when we look at the performance of our facilities, at the performance of our health systems, we don't just look at indicators of access and of quality, but the well-being of the workforce becomes a core performance indicator of the health of our health systems.
Thank you so much, Natasha, for that. Colleagues, we still have the floor open for questions if you have any. And in the meantime, I'd like to ask one more, and I think this is an important one because it's about patients. We talk about health workers a lot, but of course, these findings are sobering. They show that 1 in 3 doctors and nurses has symptoms of depressive disorder. So the question is, does this present any danger to the patients that they are serving? Natasha, I'll come back to you if that's okay.
So, Banu, of course, let me first start by saying that what we are seeing today here is not new per se. There is extensive literature over the years that has shown the increased risk of anxiety, depression, suicidal behavior in healthcare professionals. And having said that, we should not alarm the public, but we also saw in our report, Banu, that one of the triggers for this anxiety and depression, for example, is the harassment, the threats, which sometimes also come from the public. And it's very complex because this is often the result, for example, of long waits for services. But our appeal over here to the public is to understand that our health workers are under pressure, and therefore there should be zero tolerance for aggression, whilst understanding that everyone who encounters the health service is typically going through a difficult time, and so emotions may be running high. But the professional-patient bond is a very deep and rich bond. Let me, however, note also that when we look, for example, at patient safety and the literature on patient safety, which is not the focus of today's report, we do know that tiredness and exhaustion impacts negatively on patient safety. So indirectly, when this report is showing us that many doctors and nurses in our region are working very, very long hours, it is all interrelated. And this is why we are saying the mental health of our doctors and nurses, and let me say all our health professionals. We only cover doctors and nurses in this report, but this is not to say that other health professionals may not also be struggling with these difficulties, is not only important because we care about the individuals, but is having, of course, a wider systemic impact on the health system.
Wonderful, thank you. The overarching message, be kind, it seems to be the overarching message, regardless of the mental health of the person you're speaking to. So we're coming to the end of the press briefing today. I'd like to give the floor once again to the regional director for any closing remarks. Hans.
Thank you, Banu. I would like to thank the European Commission for supporting this very, very first ever survey, and especially all the healthcare workers. Like Natasha was telling, not only doctors and nurses, people also caring for our elderly people and everyone else. And I think the good news is that the solutions not necessarily cost a lot of money. The recognition by the leadership, the management, and appreciation of the public can bring us already a long way. Thank you so much, everyone. Be healthy and have a nice day.